Again for tuning in to these regular daily 1 o'clock updates. Tomorrow is Easter, so we're going to do something a little different. We'll be taking a day off from these press conferences, and instead I will have a video message played tomorrow for Easter. For those of you who celebrate Easter, I wish you a very happy Easter. And of course, I want to remind you all to obey social distancing, even though it's a special time of the year and a day you might normally get together with family. Today, I'm very sad to report another 7 deaths in the state of Rhode Island as a result of coronavirus, bringing us to a total of 56 deaths. We have 334 new cases in Rhode Island for a total of 2,349. And we now have 183 people in the hospital. And I'm going to make note about hospitals in a minute. I want to start on a serious note and pick up what I mentioned a minute ago. This is Easter. It's one of the most special days of the year for Christians in Rhode Island. And it's a day that many of us are used to being with our families. And it's going to be very, very tempting tomorrow to say, oh, can't I just get together with my family? Let's go to auntie's, let's go to grandma's. It's just one dinner. We've been cooped up in the house alone for 5 weeks. I am asking you now, please do not do it. Don't do it. I'm not going to do it. It's going to be very hard. This will be the first Easter in my life that I haven't been with my mother, my sister, my brother, all our nieces and nephews. And I hope to never have an Easter like that again. And I hope you never have to have an Easter like that again. Please resist the temptation. I know it's brutal to be stuck in the house. I know Easter comes once a year. By the way, the Easter Bunny is coming. He's an essential employee. But please resist the urge to get together in a large family gathering or with friends and maybe come up with some new family traditions. In our house, we're trying to get creative around new family traditions to get us through this year. The love and the faith are still there, but please obey the social distancing tomorrow. Right now, we are in an incredibly critical period where we still have a chance to make sure that this virus doesn't spiral out of control. And unfortunately, even 1 or 2 or 3 days of letting up on social distancing will really set us back. So when you have that urge to just sneak out to go see grandma for a little while, stop, don't do it, pick up the phone, call her, and just know that even though it's hard, what you're doing is truly life-saving. Not just for you and your family, but for all the rest of Rhode Island. And I also want to remind you, there's a lot of people in Rhode Island right now out of work. It's such a hard time. People have been out of work for a month or more. And I want to get them back to work because they're suffering. So if you hang in there a little longer with these extreme social distancing measures, I can get everybody back to work sooner. So I'm just asking you, do the right thing, and believe me, I know it's hard. The same thing goes for shopping. I keep getting reports of too many crowds in big box retailers, Lowe's, Home Depot, grocery stores. Don't go out if you don't need to. I want you to ask yourself, is it really essential that you go out today to buy supplies for that home improvement project? Because if it's not, you should be staying home. And if it is, then go. But keep a 6 feet distance and wash your hands and wear your cloth mask covering, face covering. If you have to go to the grocery store, obviously you have to go to the grocery store. I know it's a holiday. You want to have extra food for the holiday. Fine. One person from a family goes to the grocery store at a time. Don't bring the whole family, and don't allow yourselves to be crowded. This is very simple. If today or tomorrow you find yourself somewhere in a line in a checkout line, in a line to get into a store, in a line to pick up food for takeout, and you're close to people, you're doing something wrong. Back up, get space, wash your hands, make sure you have your mask on. This is so serious, and right now, we have a chance to really change the slope of the curve and the timing of the curve, and also buy ourselves a little more time to get ready for when the surge comes. I also want to make a special plea for people who have loved ones in nursing homes. This is going to be very hard. Your mom, your grandmother, your grandfather, your uncle, your favorite friend is in a nursing home, is in a retirement community, is in assisted living, and you're desperate to go visit them for Easter. Don't do it. For nursing home operators, do not relax the ban on visitors, not even to let people go in and give a gift. And I'm asking families, do not try to deliver gifts for Easter. Do not try to deliver a plant. Do not try to deliver candy. Do not try to deliver a gift. Please. That might sound harsh, but it's probably going to save the life of your loved one and all the nurses and doctors and CNAs there and other people's loved ones. And the doctor will have further announcements about that in a minute. We have to stick to these restrictions, even though they're getting harder than ever. If you'd like to go for a walk, it's a beautiful day. I think tomorrow's going to be a nice day. I would encourage you to get outside. Everybody, remember to exercise, remember to go outside, go for a walk, enjoy the day. But do it in a way that's safe. Keep an appropriate social distance. Don't bunch up in large crowds. If you go to the park, don't get too close to each other. And we're going to be out and about. I've been in touch with mayors even today. They're all going to be patrolling outdoor spaces all weekend. Go out and enjoy yourself, but don't bunch up in crowds, because if you are, we're going to break it up. I also want to note that holidays are a difficult time for many people, especially those people who don't have a great support system, who are struggling with mental illness, who might be in recovery, who are struggling with addiction, who live alone, and I know that. It can be a very difficult time. And then on top of the holiday, you're dealing with all the stress and anxiety of coronavirus. So don't let yourself get isolated. If you're feeling like you need help, the help is available. We have a 24-hour behavioral health hotline, and they can connect you with somebody who can take care of you. It's called BH Link. It stands for Behavioral Health Link. And the phone number is 414-LINK. 414-LINK. Don't let yourself be cut off from help. And certainly know that you're not alone. And let us be there for you if you need help to get through the holiday or get through this difficult time. I want to provide you with some reassuring news about hospitals. I'm getting asked very frequently, do we have enough hospitals? Do we have enough hospital beds? Do we have enough doctors? Will we have enough ventilators to meet the surge? And I want to give you some confidence and let you rest assured that the answer is yes. If you get sick, we're going to be able to take care of you. You have a lot of people working literally 24 hours a day, 7 days a week, to make sure we're going to take care of you if you get sick. And by the way, because Rhode Island has done a great job of closing down our public spaces and our restaurants and obeying social distancing, it has bought us time to get ready for a surge. And we've used that time very wisely. We have spent every minute of every day for the past 4 or 5 weeks to get ready for a surge. And that includes at our hospitals. So, as I've said from the beginning, we are working for the best, but preparing for the worst. So this morning I began my day touring the hospitals that are in construction. one at the convention center and one in Cranston. And Care New England and Lifespan are working hand in glove to prepare additional hospital beds at 3 sites around the state to make sure that we will have what we need if and when we have a surge. I have to say, and you should know, that what is happening at these 3 centers is nothing short of truly extraordinary and heroic. And to all of you who are out there working around the clock to ready these hospital beds, I cannot thank you enough. I was blown away with what I saw this morning. It is so impressive. We have teams of doctors and nurses and healthcare professionals collaborating around the clock with architects, engineers, medical suppliers, the National Guard, builders. They're working 2 12-hour shifts a day, 7 days a week. Literally 24 hours a day, 7 days a week. And it is what they are doing in preparing these hospitals. They're doing about 6 months worth of work in about 3 to 4 weeks with great detail and great care. I have heard the word makeshift hospital, field hospital, and it's true, the convention center is not a hospital. It wasn't built to be a hospital. The facility in Quonset was a retail store. The facility in Cranston was a bank. So it is true they weren't built to be hospitals. But I don't want you to think it's cots in a gymnasium. These are going to be top-class healthcare facilities where you can be cared for and where you can get better. And to the men and women out there, I think you're awesome. And I want to thank you for all that you're doing. By the way, it was good to see hundreds of Rhode Islanders working. And I know you're working hard, but I'm so happy that you're there and working and you're with us in the fight. We also need to prepare our existing hospitals to take on more patients. We've had every single hospital prepare a surge plan so that each hospital can operate at 120 or 130 or 140% of what they normally would. To that end, they need a hand, they need more flexibility to do that, to run these hospitals and to staff these hospitals. So yesterday I signed an executive order that will give our hospital system critical flexibility. We need to ensure that we can care for more patients than usual. I want you to know the hospitals have taken every step necessary to safely accommodate as many coronavirus patients as possible in their facilities. And I want to thank particularly Lifespan and Care New England, our 2 biggest hospitals. You guys have been fantastic. The order gives the hospitals the ability to operate alternative hospital sites. So Lifespan and Care New England will be operating at the convention center and in Cranston and at our alternative sites. We're also taking steps to attract more critical healthcare workers to Rhode Island, and I have signed an executive order to make it so that clinicians can practice at the top of their license, so that retired folks can come back and work, so that nursing students and recent nurses can operate at the top of their license. I want all of our healthcare professionals, they're first responders. And so I'm giving them the flexibility that they need and that every other first responder has in order to meet the needs of the crisis. And frankly, it's necessary because otherwise we won't have enough people working if and when we hit the surge. So I'd also like to take this time, first of all, to thank all of our healthcare workers, truly frontline heroes. Thank you for your bravery. You have to be scared to be going to work, but you're doing it, and I appreciate it. Keep yourself safe. And also to call on anyone out there who has any kind of healthcare training to step up and serve. We are going to need you. If you're a trained medical or behavioral health professional and you are not currently working full-time, we need you. If you're working part-time, I need you to work full-time. If you're retired and not working, I need to call you back up. If you're recently trained or a resident or a medical student, we need you to serve. And I'd like you to go on riresponds.org, riresponds.org, and sign up to help us. And there will be compensation, and there will be training, and we will give the PPE necessary to keep you safe. But I need you to go to riresponds.org and offer your services. A couple of other announcements. It's April, and as I announced a few weeks ago, I have issued a reading challenge for all the kids in Rhode Island in the month of April. So whether you're in pre-K or finishing up your senior year of high school, I'm asking you to read every single day in the month of April. Whatever you want, magazines, books, some of each, but push yourself every day to read. We know, teachers, any teacher will tell you, any educator knows, the most important thing that we can do for our kids while they're doing this distance learning is to make sure they read, read, read. I want you to know, as of today, more than 3,500 students have logged more than 150,000 minutes of reading. That's amazing, 150,000 minutes of reading. I want to give a special shout out to Melrose Elementary School in Jamestown and Portsmouth Middle School. They've each had more than 200 students log reading minutes so far. Way to go, guys. And to every other school out there, let's amp up our reading. It's fun, you'll learn something, and it's the best thing you can do to keep your minds sharp as we go through distance learning. I'm also pleased to announce that at the end of the month, Barnes & Noble will be donating a set of new books to the Early Childhood Center, elementary school, middle school, and high school with the most participation in the challenge. So continue to read and continue to log your minutes and post pictures of yourself doing your reading and videos doing your reading with the hashtag #RIReadsAtHome. I also want to thank Trinity Academy for the Performing Arts in Providence, Western Hills Middle School, and Parkview Middle School in Cranston for sharing a ton of your photos of your staff and your students reading. So not only is this fun and the right thing to do, but if your school reads the most, you'll get the prize from Barnes & Noble. I have to give a big shout out to the public libraries across the state that have been working hard to provide online resources and virtual story times to our families, even though their buildings have been closed to the public. And we have 13 public library locations who are offering curbside pickup for families. This is a tough time, but I love the creativity. Curbside pickup. It's smart, it's creative. Thank you, guys. Thank you so much. Finally, I'd like to recognize several organizations that have been working hard to put together a packet of free books for students across Rhode Island. Books are Wings, Reach Out and Read, Rhode Island Center for the Book, and Rhode Island Festival of Children's Books and Authors. Together, they've delivered more than 6,000 books to schools and meal sites across the state. Thank you. Not every kid is lucky enough to have books around the house, and because of you, 6,000 books are getting in the hands of kids who need it, who are smart and talented, and deserve to have a chance to be able to read. So thank you for your donations. Thousands more are set to be delivered by the end of the month. If you are interested to support their efforts, you can make a financial donation to any of those nonprofits on their websites. So if you, in this crisis, if you're one of the lucky ones, you're still working, and you have something to spare, please consider going on the website of one of those nonprofits and making a donation so we can continue to get books out to all the kids in need. I will say I cannot thank our educators enough. With each passing day, you are getting better and better at distance learning, more creative, more committed, better at working out the inevitable kinks. So to all the educators out there, thank you from the bottom of my heart, and thank you on behalf of the 142,000 school kids who are learning because of you and your efforts. And to the moms and dads and aunts and uncles and grandparents out there who are in the house giving a hand to your kids in distance learning, I want to thank you too. It's another thing on your to-do list at a time that we're already stretched, but it's working. These kids are learning, and it's because of you. So thank you to all of you. Finally, as I've said so many times, it's a hard time for all of us. It's easy to get down. But I find hope and optimism and strength and energy in the millions of acts of kindness that are happening every day all over the state. And they are happening, and they are extraordinary. So I want to take a moment to highlight one effort in particular. Family Service of Rhode Island is providing home delivery of cleaning supplies and food for some of our most vulnerable Rhode Islanders who cannot afford these essentials. They're getting more than 150 requests a day from Rhode Islanders in need. So again, I would say if you're lucky enough to be in a position that you might be able to spare a bit to help somebody in need, please do it. And you can do it by texting "Be Safe" to 44321 or going to Family Service of Rhode Island's website. So go to the Family Service RI website. They need donations from anyone who's hearing me. If you're a corporation, if you're a family, if you're an individual, if you can make a donation to Family Service RI, I'd appreciate it. They're helping hundreds of families a day to provide basic necessities like food and cleaning supplies, all the things that these families need. I will say, if you're among the families in Rhode Island who are the most vulnerable, maybe you live at or below the poverty line, maybe you struggle with homelessness or addiction, this is layering on coronavirus on top of that is it's causing unimaginable levels of stress and strain and human suffering. So please, if you have it in you and you're in a position to help, I'd ask you to donate to Family Service RI and have faith that it's a well-run operation and every penny you give will get into the hands of somebody in need. So I'm going to turn it over to Dr. Alexander Scott and come back for questions.
Thank you, Governor. Good afternoon. I also want to wish a blessed and happy Passover and a happy Easter to those who are celebrating this weekend. As the governor said, we have 334 new cases today. This brings our total to 2,349. That means we are continuing to advance our approach that the governor has shared over the last couple of weeks of being very deliberate and strategic, expanding our testing. We will then see increased number of cases and be able to activate our expansive contact tracing program. So continue to log your contacts so that we can start to activate, making sure that people are reached who need to for quarantining and for isolation if they actually have symptoms. As the governor also shared, we very sadly have 7 additional fatalities to report. We now have 56 COVID-19 associated fatalities total. One of the people who passed away was in their 50s. One person was in their 60s, and the other 5 were in their 80s. Given that older adults and people in congregate settings are more vulnerable to the complications of COVID-19, we continue to work very closely with nursing homes, group homes, other congregate settings, as we have been discussing. In advance of the holiday weekend, we had a call yesterday evening with nursing home leadership to once again reiterate the absolute directive to not allow any visitors to their facilities. These facilities are also taking the very aggressive approaches that we have in place, screening every single healthcare worker, checking for temperatures multiple times a day, sending anyone home who has any symptoms, and surgical masks for those who are healthcare workers working in nursing homes as well as in hospitals. We understand that the message to families to not visit those in a nursing home is a hard one. We know that that has been difficult over this time. People want to be with their loved ones all the time, and especially on the holidays. On top of that, it's our traditions, our family traditions, our faith traditions, that are very powerful in grounding us and bringing solace during difficult times such as this. We understand that people want to connect this weekend and on every other day. Our ask is that you please be a little creative. We want you to know why we are saying there are absolutely no visitors, no packages being sent. It's to keep people safe. In knowing that, and everyone being on the same page in agreement that that's what we ultimately want to do, we want to keep Rhode Islanders safe, we want to keep our nursing home residents safe, we want to keep our healthcare workers safe, then we have to be creative on how to continue to show the love that we know continues for those in nursing homes. It's critical that we cannot gather in groups larger than 5 with anyone, anywhere. And we cannot visit people in nursing homes. Ways to be creative includes just picking up the phone and calling, includes doing a video chat. We absolutely want you connecting with your family members in nursing homes, and we definitely want you to let them know how much you love them. But we need you to find other ways to do it so that everyone can be kept safe. You cannot do it in person. That also means cannot go to the windows of nursing homes. We've heard about people going to nursing home windows, and with the weather getting nicer, sometimes those windows are getting opened to speak to the nursing home residents. That's almost as equivalent as face-to-face contact. It is not safe. It is not allowable. We must not do that. We must find ways to communicate with our loved ones remotely, being creative. Please do not go to the windows of your loved ones at nursing homes. That was a key message on the telephone call that we had with nursing home leadership yesterday, that they shared of wanting to get this message out to families. We also talked to nursing home leadership yesterday about packages and deliveries. Every time a new person comes into a nursing home, such as a delivery person delivering a package that you've sent, that is a potential new exposure for those residents as well as for the staff. It is not safe. Given the situation that we have in nursing homes, we want to take every measure we can to limit risks of new infections. We are doing everything we can to limit the traffic at nursing homes. I shared yesterday how even for going into a nursing home resident's room, we're looking to, and spoke yesterday again with nursing home leadership, about having one person do the task that 3 and 4 people used to do, just so that we can limit the different types of people entering nursing home resident rooms. We want to do the same with limiting different types of people entering nursing home resident facilities, and that includes delivery people. So we want to tell you in advance now, please do not send packages and flowers to your loved ones in nursing homes for the holidays. Shouldn't be done anytime, but it's a particularly important message during this holiday weekend. Again, our word today is being creative. You can be creative. Take a picture of the flowers you bought and send it to mom or dad or grandma or grandpa on a phone via text, or whoever the person is that you know in a nursing home, be able to send the picture to them via text or some other electronic way. You could also do a video chat to show them what you bought. But please do not physically send it. We know this is a stern message. It's uncomfortable for me. We want usually people to really be experiencing and receiving the love, but this has to be a stern message. Everyone understands what's happening in nursing homes and what's potential in other healthcare facilities. And as I said, we all agree that we want to keep all Rhode Islanders safe. In order to do that, we need to be as aggressive as we can to stop transmission and introduction of any new cases. We ask that you please understand that intent and to continue to work with us in helping you to keep your loved ones alive. I want to add another message. We've been contacted by a lot of people saying their employers are requesting doctor's notes to allow them to come back to work after being in isolation. We understand the desire for that, but we also want to find a way, working with employers, to make it so that we are not overwhelming our healthcare system with the request for notes in order for someone to work. We will continue to work with employers and their employees on this, but I want to make this statement. You can return to work without a doctor's note if you have had COVID-19 or a COVID-19 illness, as long as it has been at least 7 full days since symptoms of COVID-19 or a COVID-19-like illness started, and as long as you have had no fever for the last 3 days of that illness, and that's without taking any medication to reduce fever. You have to be fever-free for a full 72 hours during the last 7 days of that, and all of your symptoms have to have resolved. So that can sometimes take longer than the 7 days. It has to be a minimum of 7 days, 3 days with no fever and no medication to reduce fever, and all symptoms resolved. That is the message that we're giving employers of when it is then safe to return to work. All people who go into isolation because they are sick with symptoms of illness should stay in isolation completely until they meet all of those criteria, period. However, if you are someone who is still working, a doctor's note should not be required to go back to work after your period of isolation ends. We will continue to support employers with the information needed to help address that and want to make sure that we are doing it in a way that does not overwhelm the healthcare system with needing notes. So we'll continue to equip you with that information. Again, I want to wish everyone a blessed weekend and holiday. If you follow the governor's recommendation about getting fresh air because it is nice outside, remember to wear your cloth face covers so that you are preventing spread of any illness or infectious particles, even if you are feeling fine. Remember to wear that outside. Remember your 6 feet of social distancing. And remember, it should really be as few people as possible. We're saying less than 5, really 2, 3, and it should only be the same people you are with. That's an important message. It can't continue to be, today you go out with these 3 people, and then tomorrow it's with a different 3 people. Choose those same folks that you are with, that you live with from your household, that you are looking to stay safe with. So with that, I will pass it back over to the governor so that we can get started with questions. Thank you.
Good afternoon, Governor.
Good afternoon.
And to everyone at home, including Michael Bilo of Motif Magazine, whose question landed first in the queue today. He asks, if someone comes into Rhode Island for a day or two, not intending to remain, to work on their house or boat and not interacting with anyone else, is this work-related or otherwise exempt from the 14-day quarantine rule?
Yeah, so thank you. I'm not sure I fully understand the question because that would suggest they live someplace else, and my authority, of course, is only over people in Rhode Island. But here's what I would say. The order I have in place is a stay-at-home order. Everybody needs to be doing everything they can to stay at home. That means avoiding any out-of-home activities that are not absolutely essential. So some of us, many of us, have to go to work. If you have to go to work, abide by social distancing, wash your hands constantly, wear your mask, go home. If you have to work in Massachusetts or Connecticut, same thing. Drive across state lines, come home, and stay in your house. For those, the quarantine, as it relates to people coming here, is if someone comes from any other state, by any means, car, bus, train, plane, and they come into Rhode Island with an intention to stay here for a non-work reason, they must remain in quarantine for 14 days while they are in Rhode Island. So hopefully that clarifies. There will doubtless be, I find that people are saying, what about this precise example? What about that precise example? Look, here's the deal. We want you to be in your house. We want you to stay away from people. And we want you to limit your activity to as few number of people as possible, period. So don't look for ways to push the limits. Stop asking, in all of us, stop asking, how can I push it? How can I do this? The answer is don't do it. Stop. We got to do this until May 8th, because then hopefully after May 8th we can get, think about at some point returning to life in a new normal.
Steve Alquist of Uprise, Rhode Island, reports there was a pandemic-safe protest outside the Wyatt yesterday. You said the Wyatt is outside your legal authority, but would you lend your moral authority to the cause and support California-style legislation banning private prisons and ICE contracts in Rhode Island?
Yeah. So I have already said that I would support legislation banning private prisons in Rhode Island. As it relates to Wyatt, it is a federally run prison over which I have no authority. Having said that, I care about everybody who's in my state, and I have been in touch, my staff has been in touch with Wyatt, with the federal marshal. I've been in touch with the federal courts and urge them all in the strongest possible terms to do everything they can to protect public health and human rights.
Our next question is from Ryan Belmore of What's Up Newport. Governor, when do you plan to provide further guidance or announcements regarding your orders that have closed schools, restaurants, and businesses?
Yeah, so right now all of those restrictions are in place until May 8th. And the honest answer is whether I have to extend those beyond May 8th depends totally on how well we comply with the restrictions between now and May 8th. So the best thing I can tell you is right now, until May 8th, clamp down. Don't push it. Follow the rules as strictly as is humanly possible. And that gives us all the best chance for me to start easing restrictions as soon as possible.
Tara Granahan of WPRO Radio asks, Dr. Mokdad, the physician behind the coronavirus pandemic model at the University of Washington, said yesterday that, quote, the worst is behind us as a country, end quote. Where is Rhode Island's model?
Where is Rhode Island's model? I mean, we have a model. Is the worst behind us in Rhode Island? No, I don't think so. I think the surge is ahead of us, not behind us. But again, it all depends on how well we do. If everybody this weekend, it's a nice day, starts to go and crowd into the garden centers of shops and go home and plant in their community garden or spend Easter tomorrow in big crowds, the worst is definitely ahead of us. So it's up to us as individuals to do the right thing right now in order to minimize the pain and minimize the slope of the curve and kind of flatten out the line, as we've been saying.
Eli Sherman asks another question. Based on state modeling, when do you expect the state will need to start using the 3 new hospitals?
Our goal is to have at least one of the hospitals up and running in a couple of weeks. And I think that will happen. I think the Convention Center Hospital should be able to take patients in a couple of weeks, and I don't foresee a scenario where we need it any sooner. Because again, as I said, the first step is increasing capacity in the existing hospitals. So right now there's bed availability of our existing hospitals under normal circumstances. Then each hospital has surge plans in place to extend their capacity in their hospital. And then it's only after that that we would go to the additional hospitals. So I think we're several weeks away, and I'm confident we'll be ready by the time that time comes.
Daniel Kittredge of the Cranston Herald is asking the following. Can you tell us a bit more about the contact tracing process, how quickly it currently occurs after a positive diagnosis, and how determinations are made regarding which potential contacts may have been infected?
So I'll start with the second part of that question. There's a very in-depth process that occurs with the initial part of contact tracing, which is case investigation. We have a conversation with the person who is a positive case and do a full landscape assessment of all of the people that they have been in contact with from a time frame before their onset of illness until when we are in communication with them. Some descriptions of a direct contact who is at highest risk of transmission includes people who have been in close direct contact, less than 6 feet of distance, for more than 10 minutes at a time. And so that oftentimes automatically becomes household contacts, but then you also look at who someone is exposed to at work if they have been going to work, which is why we are strongly promoting working remotely anytime that you can. And then it also involves other scenarios where you may have come in contact with someone. That's why we cannot underscore enough the importance of keeping track of who you have been in contact with. In terms of how soon we are able to reach someone, we are collecting information from a variety of laboratory sources regarding positive cases. And we have had a significant increase in the number of cases. So we're balancing having an expanded team to be able to respond and to be able to collect the laboratory information so that we can reach the people who are needing to be contacted. That time frame can be as soon as within the hour of us finding out to within a few hours, knowing, such as yesterday, the 334 new cases that we received. So we're looking to expand to be able to continue the rapid turnaround time that we need in place to be able to do that.
Next question is from Joe Tasca at the Public's Radio. What is the state doing to address safety concerns at Electric Boat and other essential businesses?
Thank you for the question. We've been in extremely close contact with Electric Boat. Myself personally and Commerce Secretary Pryor is in very close contact with them. We're also in contact with dozens of manufacturers and the Rhode Island Manufacturers Association, all to continue to check in on them to make sure that they're obeying the social distancing rules, taking temperatures of employees, making sure nobody goes to work sick, making sure people have the opportunity to work 6 feet apart. Most manufacturers who've remained open have completely redone their floor plan so that employees can work safely. So we are on it to the extent we can be, in constant contact. And I would say if anyone out there works at a manufacturing operation or knows of a manufacturing operation where you feel that these conditions aren't being met or employees are not given the opportunity to work in a safe environment, I want you to let us know. You know, go online to the Department of Business Regulation, DBR, or call them, or send an email to the governor's office. Let us know so we can address the situation. I made a decision to allow manufacturers to stay open. Many states have not done that. I thought it was important because I need to maintain a semblance of an economy and keep as many people working as is safely possible. That decision depends upon manufacturers to make the adjustments necessary so that their employees can stay safe. And I will say manufacturers on the whole have been fantastic and great collaborators. So thank you to the manufacturers and the Manufacturers Association. And if you know of a situation where you think it's not going well, then let us know so we can take care of it.
Amanda Milkovits of the Boston Globe is asking, how many healthcare workers do you need and what do you have?
Thank you for that. These numbers are fluid, so I hesitate to say specifically a number, but can certainly get back to you in providing that. It's helpful for people to understand that as the modeling is being done and we are projecting out, preparing for the hospital sites that the governor shared, we need to have enough staff to be able to provide the care in those hospital sites. And we know that what we have now requires more. Those are numbers and directions that I can share, and certainly will reiterate the call out to anyone who has any type of clinical background to please join us and go to Rhode Island Responds so that we can compile that information and have a more accurate assessment to the fluid numbers of where we are now and what we will still need.
The next question is also for you from Kate Nagel of GoLocal Prov. Is Rhode Island allowing hydroxychloroquine to be prescribed as a treatment to COVID-19?
We are working closely with infectious disease experts throughout the state who are really the ones that have the most familiarity with prescribing hydroxychloroquine. So it is not banned from being used, but we want to make sure that hydroxychloroquine is only used for COVID-19 in the specific indicated situations it is used for. That's hospitalized settings with infectious disease and other clinical experts who are most familiar with being able to use it. We do not want hydroxychloroquine just used in the community or with providers for people who do not require it, because there is then a concern for people who actually are using hydroxychloroquine for an FDA-approved, indicated reason, running the risk of not having access to that life-saving medication that they need it for. So we need to make sure that we are clear that hydroxychloroquine is only being used in those specific situations with the specific indicated clinicians who have been authorized to prescribe it.
I'll read the next question by Nancy Thomas of Rhode Island News Today in two parts. Rhode Island is listed on National News Today as being a new hotspot with a 189% increase in cases. Does this not only reflect the increase in number of people tested, correct?
In essence, we know that we are testing more people, and that has been our deliberate approach. And because of that, we knew we would be identifying more cases. We want to get a full landscape of the state. We actually have the population that allows us to do that, to understand who is out there based on testing or based on symptoms so that we can identify them, get them into their proper isolation settings with the support that they need, and address all of the contacts that are around them who can also be quarantined, staying at home and monitoring themselves for symptoms. That is the most effective way for us to get a handle on this virus as a state.
Nancy continues to ask, how correct is any data being reported on at a national level?
Everyone nationally has this challenge of being able to capture as much as they can of their population in terms of testing, being able to collect the data to understand who is positive based on testing. That means being able to do what we are doing here, is developing a specific strategy for accessing our vulnerable populations, those who may not be able to drive, those who may be homebound, those who may not have the economic means to get somewhere where testing is available. We are putting together deliberate approaches to being able to address those folks so that we can understand the landscape of the entire state's population of people that need to be tested, and do it as well with symptoms. We want to make sure that we are rolling out the contact tracing program for anyone who is tested, and all that get tested should have symptoms, as well as anyone who may not have been able to be tested but still has symptoms. We still want to make sure that they are receiving the proper isolation, as well as their contacts being quarantined appropriately too.
Thank you, Doctor. We'll take this last question from Christian Winthrop of the Newport Buzz.
Marty.
Sure.
I want to offer two comments related to two of the questions that Nicole did a terrific job answering. With respect to how many healthcare professionals we'll need in the surge, I want to say two things. The answer to that question depends on how many people we have in the hospital at any one time, obviously. The way we are working with our healthcare providers to develop protocols that are best in class. Again, if you wind up in one of these quote-unquote field hospitals, you're going to get best-in-class treatment. So they have protocols. You need this many doctors per 40 patients, this many nurses per 40 patients, this many aides per 40 patients, et cetera. And so we're building our model and making sure, as I've said all along, we are working for the best, planning for the worst. And I want you to have confidence that even if we have 2,000, 3,000, 4,000 people in the hospital at any one time, we're going to have the doctors and nurses and healthcare professionals to take care of you. In order for that to happen, that's why we keep saying, help us out if you can, if you're retired and not working full-time. But I want you to know that's the thinking behind it, and also why it's so important that people sign up. Then there was another thought, and it just flew out of my head. But anyway, people are getting nervous about this, and I think it's important that people know we have this plan. If we obey social distancing, we may never get to that point where we have thousands of people in the hospital at once, but I'd rather be prepared and not need it than need it and not be prepared.
The last question is from Christian Winthrop of the Newport Buzz. When do you foresee those who have contracted and recovered from COVID-19, including those who have not yet been tested, to be able to resume day-to-day activities?
I think Nicole answered that question earlier, so I'm not going to continue to go into that. I remembered what I wanted to say. As to the hot spots, this is an important thing for Rhode Islanders to realize. Although we're doing extremely well, we're testing among the most per capita in the country. You've got every Rhode Islander doing a great job, by and large, obeying social distancing. We have two things working against us. Number one, Rhode Island is the most densely populated state in the country. Density is not a good thing when you're dealing with the virus. It's harder to stay away from people when we're densely populated. The other thing is, relative to many other states, we have a high percentage of seniors in Rhode Island. So, again, are we a hotspot? Is the data accurate? The data is as accurate as it can be. It's difficult to do state-by-state comparisons. We're doing a lot more testing than other states. But you do need to know a couple of the things that make this fight harder for us is we have a high percentage of seniors who are the most vulnerable and have the highest risk of the worst outcome if they get the virus, and we're very densely populated, which is my way of saying, please obey the social distancing, because it's the only chance we've got to get through this as safely as possible. Good? Do you want to answer that again? Sure. It was important.
So I'll answer again the question of, after someone has COVID-19, what are the requirements that need to be in place in order to say that they have recovered and can resume their day-to-day activities, which should still be staying at home? The first is there should be at least 7 days of illness between the time the symptoms started and when that is. If someone gets better in a shorter time frame than that, then they need to wait until at least 7 days have passed. Most people are going beyond the 7 days. The second is, in addition to the 7 days, the final 3 days need to be days with no fever without taking any fever-reducing medication, Tylenol or Motrin. You cannot say you're without a fever for 3 days if you've been taking Tylenol or Motrin or something else to reduce fevers around the clock. So 3 full days of no fever without taking any fever-reducing medications, and your symptoms have to have completely resolved. It can't be that there's still, you're getting better, but not completely resolved. And so all of that usually takes more than 7 days. So 7 days is the minimum, 3 days with no fever, and having all symptoms have resolved. That then should mean that you can maybe come off of being isolated within your own home to minimize transmission of infection to other people, but it definitely also means that you should still continue to follow the stay-at-home order, still continue to work remotely, still only go out if you have essential needs, groceries, come right back home. The reason is there is still risk of additional infection. So we want to make sure we're still learning about that, but we want to make sure that people clearly understand it doesn't mean you can start disobeying any of the rules that are in place. Everyone needs to follow them. That is how we're going to get through this together. So with that, thank you very much.
Thank you. Thank you. Take care.